Hi everyone, it's Lenore, Khoubesserian with the Medicare Authority, and this is Medicare 101. So if you don't already have a pen and paper, go ahead and grab it. We have a bunch of stuff to talk about today. This video is for those folks who are new to Medicare, turning 65, looking for information on Medicare, or those folks already on Medicare looking to complete the process. We're going to talk about what Medicare is, who it's for, the original parts of Medicare, A and B, how to get Medicare or when to enroll in Medicare, when does Medicare start, the major exposures of Medicare and what you can do about it, what your coverage options are with Medicare, what's the difference between a Medicare supplement plan, also called Medigap, and a Medicare Advantage plan known as Part C. What a Medicare Part D drug plan is, that's called prescription drug coverage. What Medicare does not cover and what you can do about it. We'll expose some common Medicare myths, and then we have a little bonus. We get asked a lot of questions about Social Security and retirement. So we're going to talk about that as we go through Medicare. So before we get started, let me introduce myself. This is me with Betty Boop at the Jackson Hole Diner in New York. They have the most amazing hamburgers or burgers. So if you haven't been there and you're in the neighborhood, they are in Queens and they give the best they have the best burgers. But enough about that. Let me tell you a little bit about me. So I've been working in the insurance world for over 30 years. I started my career right out of college working in human resources. I was an HR director for companies like Coca-Cola, Kraft Foods, Entenmann's, Graybar, as well as some small mom and pops. I was an adjunct business professor. I have an MBA, a business coach, team builder. For the past 15 years, I've dedicated my time, my energy into helping people understand Medicare and their retirement options. It is something that I am passionate about, and I really want to help you take the scare out of Medicare. Throughout the video, you're going to see some of our clients love talking about the stories so that you can understand Medicare a little bit better. If you want to check me out, you can go to my website, MedicareAuthority.com, my Facebook page, Lenore Khoubesserian, the Medicare Authority. But the Google reviews tell it all because these are directly what clients are saying. We have over 500 five-star Google reviews, and you will find out how we work, what options we offer people, and you'll see how we've helped so many people figure out Medicare. Okay, so we're going to start from the very beginning because people get confused about insurance, and Medicare is no exception. So first off, Medicare has been in place since 1965. It is federal health insurance for people 65 or older. Now, folks under 65 with Social Security on certain disabilities will also be eligible for Medicare. Those folks will typically get their Medicare 24 months after becoming eligible for Social Security disability. Medicare is broken into parts. It's a lot different than what we're used to today. So remember, it's been in place since 1965, over 60 years. Part A is called your hospital coverage. That is covering the room and board of a facility only. There's no monthly cost for Part A as long as you have 10 years or 40 quarters of work. Part B is called doctor or medical coverage, and that does have a monthly cost starting at $202.90 a month. That's the 2026 monthly premium. Those folks who have higher income will pay more for their Medicare. Those folks who have lower income, it would have to be significantly low, would get extra help on paying their Medicare premium. But for most of us, the premium is going to be $202.90 a month. The parts of Medicare. Now, this is confusing because we're used to having insurance all under one umbrella. However, Medicare Part A is called hospital coverage. It's covering the room and board of being in a skilled nursing facility or a hospital. That will include your semi-private room and board, operating and recovery room, in the intensive care unit, general nursing services while you're in the facility, lab tests, x-rays, drugs furnished by the hospital, medical supplies, and short-term rehab services. It's not long-term in a nursing home. It's short-term. Part A does not include your doctor fees, private duty nursing, no private room unless it's medically necessary, personal conveniences like a radio, TV, or telephone, not included under Part A of Medicare, and of course long-term care such as custodial care is not covered under Part A. Part B is where most of your stuff is going to fall when you're on Medicare. Part B is going to be your doctors, your specialists. It's going to be all those home services, diagnostic tests, procedures, immunosuppressive drugs, things that are infusion or injection in a doctor's office are going to be covered under Part B of Medicare. Anesthesiologist, surgeon fees, even while you're in the hospital, those bills will fall under Medicare Part B, not A. Outpatient surgical centers, urgent care, physical and occupational therapy, medical supplies, x-rays, lab tests, radiology received as an outpatient, ambulance, durable medical equipment such as wheelchair, oxygen, and braces. These are some of the things that Part B covers. Now, Part B does not cover other things like dental care. A lot of people are surprised that Medicare is not giving you dental coverage, not giving you routine exams. They cover preventative 100%, but what we consider routine exam, not covered by Medicare. Routine foot care, eye care, and ear examinations, not covered by regular Medicare. Unless you're insulin diabetic, then you'll get some foot and eye care. Oral or cosmetic surgery, not covered. Healthcare while traveling outside of the United States, not part of Medicare. Services not medically necessary, first aid supply, eyeglasses, or hearing aids, not covered by Medicare A or B. How do you get Medicare? Well, there are 3 scenarios. Scenario 1, you're receiving Social Security benefits. Scenario 2, you're not receiving Social Security benefits. And scenario 3, you're still working and covered through the employer plan. So you're going to want to write down which scenario you fall into. Scenario 1, this is the easiest scenario. If you are currently receiving Social Security benefits, you're automatically enrolled in Original Medicare Part A and B. You receive your Medicare ID card, which looks like a Social Security card, about 3 months before your birthday. The $202.90 a month for your Medicare B is automatically taken out of that Social Security check. You really don't have a choice. It just comes right off the top. So for those folks getting Social Security, you'll automatically be enrolled. You don't have to do anything to get your Medicare. Scenario 2 is more typical. Folks not receiving Social Security benefits will manually enroll in their Medicare. So you will have to initiate that enrollment. This is really very common. You're going to go online. That's the best way to enroll yourself in Medicare. You're going to go to ssa.gov, follow the prompts to get yourself set up on Medicare. You can do this over the phone by calling the general number for Social Security listed right here, or in person. Now, the in-person enrollment is least favorable. They don't really want you walking into the office unless you have some special circumstances, like maybe you don't have enough work credits, you weren't born in the United States. You'll have to present some additional documentation to get yourself enrolled in Medicare, in which case you can go down to the office. They're open Monday to Friday, 9 to 4. You can also mail an application in. I don't recommend that option, but it is available to you. If you fall into scenario 2, you're going to initiate the enrollment, and Medicare and Social Security are linked, but you are not required to have Social Security to have your Medicare. Therefore, you can sign up for Medicare without Social Security, and you will receive a bill for Medicare. Might be a little bit of a sticker shock because that paper bill will be for 3 months of benefits. So 202.90 times 3 is 606.70. Once you get the bill, you'll be able to set up payment by setting up a Medicare.gov account. But the most important thing here is if you're not getting Social Security and you want to enroll in Medicare, you will have to initiate that enrollment. Now, the third scenario is very typical. A lot of folks are working past age 65 when they first become eligible for Medicare. They have coverage through the employer health plan. Maybe they have spouse or dependents on their group plan, or their spouse is covering them under the plan. They can choose to delay enrolling in Medicare Part B. Oftentimes we recommend that if Medicare is more expensive than being on the employer plan. You can delay the Part B because that has a monthly cost. You're not required to have the Part B until you come off the employer health plan. Now, that's as long as your employer is over 20 people, and COBRA does not count as active employment. So if you fall into this scenario, we can help you get that timeline correct, but you are able to delay your Part B if you still have the coverage through the employer. So when does Medicare start? It's always going to start the first day of the month. It's never going to be in the middle of the month. When you're turning 65, you have 3 months before, the month of, or 3 months after to get yourself onto Medicare in that initial enrollment timeline. If you sign up 3 months before you're turning 65, Medicare would begin the first day of the month. So for instance, my birthday is in April. If I signed up, I could sign up in January. Medicare would start April 1st for me. If I sign up after April, in the month of April, May, June, it's going to start the first day of the month after I signed up. Medicare is a little bit rigid when you're in that initial enrollment timeline. They're not letting you choose your start date. If you are in that scenario 3, you delayed your Medicare Part B, you're coming off a group health plan, there's forms to fill out for getting onto Part B, and you can tell them the date you want your Medicare B to start, but you will still start the first day of the month. So Medicare has major exposures. It doesn't cover everything. And one of the reasons why you get a lot of solicitation is everybody is trying to help you cover those exposures. Now, it may be a secret to you, but it really wasn't. Medicare was never meant to cover all of your expenses. There are things that people aren't aware of, co-pays, co-insurances, percentages of cost. Medicare is not giving you enough coverage. There are some major exposures if you just stuck with straight up Medicare. Hospital Part A, although it has no monthly cost, it has a deductible of $1,736 every time you're admitted to that hospital. Additionally, Part A, remember, is covering that short-term skilled nursing. Medicare is paying the first 20 days, 21 through 100. You'd have a copay of about $220 a day. After the 100 days, you're paying it all. Part B is your medical stuff, your doctors. That has a small annual deductible of $283, and this is the 2026 number I'm giving you. Once you've met your deductible, Medicare is going to pay 80% of your bill. You're going to pay 20%. The 20% you pay has no limit, no out-of-pocket maximum. So let me give you an example. I had a total hip replacement, cost about $100,000. If I had Medicare, I was hospitalized for 1 day, I would be responsible for that hospital deductible, the $1,736 for my admittance to the hospital. That would be my responsibility. If I didn't meet my deductible, my medical deductible for the year, I'm paying the first $283 of medical expense, and then Medicare is going to pay 80% of that $100,000, and I'm going to be paying 20%, $20,000. And then if I have additional costs on top of that, I'm still paying that 20%. No limit to what I would be responsible for. There's also something called a Part B excess charge. If a provider does not accept the Medicare, they can bill 15% more than the allowable. This is very rare, but it is something that you could incur. So we put together what we call umbrella options to help cover those exposures. Now, the umbrellas are not exact. Umbrella meaning protection. Minimally, you'll notice that under all the umbrellas, we're going to want to add a Medicare plan and prescription coverage. That is really going to be minimal for all plans. We also recommend cancer policy for all plans, heart, stroke, that also can be an option. Dental, vision, hearing, and then recovery care in our umbrella 3. Not offered in every state, but it is recommended for those folks seeking higher coverage. So let's talk about the two options really with Medicare. If you had straight up Medicare, you'd be paying that 20% to infinity. So you're really going to either have a Medicare supplement plan. This is also called Medigap, or you're going to have a Medicare Advantage plan. They are two completely different options. Folks get them a little confused, so we're going to go through that to help kind of clear the cobwebs here. This is a chart that came off of Medicare. Option on the left is showing you original Medicare, A and B paying the bill first. You're adding a supplement to supplement, fill in the gaps of Medicare, plus a Part D drug plan. The other option is Medicare Advantage, known as Part C. It's combining your hospital medical and oftentimes your drug coverage. Under either option, you're still signing up for your A and B and paying your B premium. But if you're choosing Advantage, Medicare Advantage plan, a bunch of companies offer that. They are going to manage your care. So let's take a little bit closer look of the two options side by side. You'll notice under either option, you are signed up for Medicare A and B and paying that Part B premium of $202.90 a month. With the supplemental option, you're buying an additional plan to supplement, fill in the gaps, pay the bill second to Medicare. You'll pay a predictable premium every month. This type of a plan will give you the lowest out-of-pocket costs when you see your doctors and you're hospitalized. Now, there really is no network because it's the Medicare network. You can choose any doctor that's contracted with Medicare, which is mostly all doctors. You don't need a referral to see this doctor or that doctor. So if you have doctors in different states, if you have 2 zip codes, if you have 2 houses, you visit family outside of where you live, this type of a plan allows you to choose your doctor anywhere in the United States. It does not include a prescription plan, so you're going to want to add that into this option. Okay, so this option will have a higher monthly cost for you to give you very low out-of-pocket exposures and the flexibility to choose your doctor across the country. The Medicare Advantage plan, on the other hand, typically has a low monthly cost on top of Medicare. Typically, that cost can be $0. You're still paying your Medicare premium, but instead of Medicare paying the 80% of the bill like it does in the supplement plan, all your care goes through the Advantage plan. It's called managed care. And when you go to the doctor, you'll have copays. If you have medical tests, procedures, hospital stay, you'll pay. So you're saving on the front end. You're paying as you go. Very much like an employer plan, your doctor visit might be $5, a specialist might be $40. Hospital major illness like cancer, they're going to have bigger cost sharing. So you're paying as you go. The plan must have an out-of-pocket maximum. We're seeing that capped at around $7,500 for in-network services and $12,000 for in and out combined. Now, the Medicare Advantage plan will include your hospital, your medical, and typically your Part D drug coverage. It can also give you those extra benefits, your dental, your vision, which is really eyeglasses, a gym membership, and some plans are offering over-the-counter non-prescription benefits. Excuse me. Okay, so option 1, the Medicare supplement plan. You have Medicare A and B. Remember those exposures, the $1,736 hospital stay, the $283 medical deductible, and the 20% cost share. That's our exposure. We buy one of these supplement plans, also called Medigap. Oops, let's go back here. Also called Medigap. This is private health insurance. It covers most of those deductibles and copays that Medicare doesn't cover. And then remember, if we choose option 1, we're adding in the supplement plan with the prescription plan. So here's a standardized chart put out by Medicare showing the letters of Medigap plans offered. Not every plan is in every market lettered A through N. We're recommending Plan G, which is sort of highlighted there, Plan G and Plan N, the last column there. And the reason why we recommend these two supplement gap plans is because they're providing the most adequate coverage at the best price available in market. So for instance, the G plan, you can see if you look down the column, is covering 100% of the hospital deductible, covering 100% of the medical cost. The only out-of-pocket that you are responsible for with the G plan and original Medicare is the once-a-year Medicare Part B deductible, the first $283 deductible. Once you've met that deductible, your cost is zero. So for instance, my $100,000 hip surgery, I have my $283 deductible. My hospital stay would be covered 100%. All my medicals and physical therapy, 100%. I have no copays after that $283 deductible. The Plan N is really a great option for those who are more budget conscious but want the flexibility to still choose their doctor. It's essentially the same. It just adds a copay of $20 for an office visit and $50 for an emergency room that we don't have with the G. So you're paying the $283 deductible for the year and the copays of $20 for doctor visits and $50 for emergency. Plan G, Plan N, which is best? It really depends on you. G is what I guess they call it the Cadillac. The premium depends on your age, whether you're a man or a woman, and where you live. Your zip code really matters. We're seeing the premium anywhere from $100 to $200 a month. Now, some zip codes will be more expensive than others, like New York State, for instance, more expensive than Pennsylvania. But the premium is going to be anywhere from $100 to $200 typically. And remember, the Plan G is giving you that high level of coverage, high level of flexibility. You have the medical deductible and really no copays. The Plan N is going to be about $40 to $50 a month cheaper. You're saving about $500 to $600 a year in the monthly cost because it's adding in that $20 copay for an office visit and $50 for an emergency room. Now, in some markets, we can have an excess charge. It's not typical, but providers who do not accept assignment from Medicare can upcharge you 15% more than the allowable of Medicare. Your G plan will pay that, your N will not. Again, this is not very typical, so the real difference is in the copay, the $20 and the $50 copay. When should you enroll in a Medicare supplement? Just some key things to understand about the supplement plans or gap plans is that they are federally regulated, they're standardized. Every G plan is exactly the same regardless of what company you buy it from. The government doesn't give you a G plan or sell one plan. There are dozens of companies in most markets that will offer you a G plan. And every one of them is the same because the government standardizes the coverage level of that G. Okay. The best time to buy this plan is when you're going on to Medicare. When you're new to Medicare or when you're coming off that employer group health plan, that is because you're going to be guaranteed accepted to the plan. You cannot be declined. You'll also be getting the lowest rate available. We're going to shop it for you. So you may not be able to buy the G or the N in the future because you have to go through an application of health questions to change the plan or buy it in the future. So if you start out with this company for your G plan and you want to switch to a different company next year to an N plan, you may not be able to do that because you have to go through an application of health questions. You're not guaranteed. So the best time to buy this plan is when you're new. These are some of the companies that we represent. They're A-rated. We probably have more. Each market is slightly different. When we're looking at these companies, we want to look at the price of the plan. The price will vary, the ease of using the plan, and we'll make a recommendation based on all of that. Some of the companies offer discounts when you have two people in the household choosing the plan. But that's some of the things that we're going to guide you through. Now, I just want to make sure you guys know we are contracted throughout the United States, and we can assist if you move from one state to another. So it's not just one state that we're contracted in, all over the United States. If you have a Medicare supplement plan, you really need to add the Part D plan. The national average for a drug plan is around $40 a month. Prescription coverage, the government doesn't give you a drug plan. They say if you don't pick one up when you begin your Medicare, you'll be penalized for picking it up later on down the road. So with option one, we have original Medicare. We're paying for that. We're buying the supplement plan to fill in the gaps. And then we're adding a prescription plan. We typically would have between 10 and 15 companies offering drug plans in each market. So how do we add the drug plan? How do the drug plans work? It's really one of the most confusing parts of Medicare. We try to make it as simple as possible for you. The government is structuring these plans somewhat. There are 3 stages of a drug plan. The first stage is called the deductible stage. So you're paying a premium for your drug plan. When you go to the pharmacy, you pick up your medication and they tell you how much you pay for the drug. In most instances, the plans would have a deductible of $615. That's the 2026 deductible. Some plans give you the generic meds without having to meet the deductible. So if you're taking generic medications, your cost of meds will be anywhere from $0 to maybe $5, and you avoid the deductible with those generics with some plans. Once your deductible is met, though, for folks using higher cost medications, you would have to meet the deductible first, and then you move into the initial coverage stage where you'll likely pay 25% of the cost of the drug. So for instance, you're using an eye drop, it's falling into a high tier level. The eye drop costs $100 a month. You're paying full price of that drug to the $615 deductible, and then after the deductible is met, you're paying 25%. So it's not going to $0. After the deductible, you're paying 25% or $25 of that $100 eye drop. If your cost, what you pay out of your pocket, reaches $2,100, you are at the catastrophic phase where your cost will go to $0. So you've reached your out-of-pocket maximum for drugs. It doesn't matter what plan you choose. It's really the same. Once you personally hit $2,100 out of your pocket, you're in the catastrophic phase. and you're no longer paying for any of your prescriptions. So we have a 5-step process for helping you choose your Part D. And the first would be to input your drugs into Medicare's online calculator. You can go to Medicare.gov and look at the calculator. We have done it so many times. We go right in there. We input your drugs into the plan finder. We input the pharmacies you would use locally to get the scripts filled. And then we compare the options in your zip code. So we're looking at the overall cost of the plan and your drugs in the plan. Now, not every plan offered will cover every prescription. So we have to make sure that the drugs you're using are in the plan's formulary. So we're comparing everything with all the plans. The Medicare online tool, though, really helps us do that. So we're going to compare them, and we're going to look for the lowest overall premium and drug cost combined to make that recommendation for your drug plan. Now, we assist you with the enrollment to the drug plan. Mostly all the drug plan enrollments are going to be on Medicare.gov. We'll assist you through the process setting up the Medicare.gov portal. I'm sorry. You're going to set up a Medicare.gov portal. We're going to help input all the meds, make the recommendation, and walk you through the enrollment of your drug plan. We reevaluate drug plans every year. Drug plans review from October 15th to December 7th. So we're real busy at this time because we have a lot of people looking for assistance in figuring out the drug plan. So we are in a plan from January to December. We can review October 15th to December 7th for the following plan year. Again, if you don't enroll in a plan, there's a 1% penalty for every month you could have had a plan and elected not to. So we don't recommend not taking a plan. So recapping, we're going to have original Medicare. We're going to add in a supplement, and then we're going to add a drug plan. This is a more expensive monthly option, but it gives you more flexibility to choose and have very little out-of-pocket exposure. Okay, so option 2 is called Medicare Advantage. Let's take a look at option 2. This is called Managed Care. No matter what, remember, we're still paying our Medicare premium, the $202.90, but if we choose a Medicare Advantage plan, instead of Medicare managing our care, all the care goes to the Advantage plan. So the bills of seeing doctors and expenses don't go to Medicare first. They go right through the Advantage plan. The Advantage plan will cover your hospital, your medical, and oftentimes your prescription. A lot of the plans are low in the monthly cost. They can be as low as $0. Some plans will run $20, $30, $40 a month. Some might be a little higher. Again, you're paying the $202.90. And then you're paying co-pays, deductibles, and co-insurance as you use this plan. Most of the regular stuff like doctor visits are pretty inexpensive. But the big ticket items like hospital, cancer, they can add up to the out-of-pocket maximum. And we recommend adding in the umbrella hospital and the cancer for sure if you're choosing a Med Advantage plan. How do we choose a plan? What do we look at? Your zip code matters. Unlike the supplement and original Medicare, the Advantage plan is based on where you live. So, for instance, those folks who live in the state of Pennsylvania could not buy a Florida plan or a California plan. So you're buying the plan or you're enrolling the plan based on your geographic area. The plans will have doctors, hospitals, and prescriptions. Not all doctors take every plan. So we're looking at the plan formulary for your medications, and we're looking at the doctor network when we're choosing a Medicare Advantage plan. That is most important if we're choosing a Medicare C Advantage. These plans, as I mentioned before, they can give you some extra benefits, a gym, some dental vision, eyeglasses, over the counter. They can give you extra benefits, but that's the last thing we're looking at when we look at Medicare Advantage. We're really focusing in, do your doctors take the plan? How and when to sign up for a Medicare Advantage plan when you're new to Medicare, you can choose this option. We have an annual election period. We can enroll in an Advantage plan every year. We can change our Advantage plan October 15th to December 7th. That's when we can look at different plans. Once you sign up for the Advantage plan, you're in it for the remainder of the year. They run from January to December. We can review new plans during the annual enrollment period, October 15th to December 7th, and then the plan would start January 1. So let's compare the options again. The supplement plan on the left, you're paying your $202.90 and an additional cost for the Medicare supplement G or N. This option gives you the lowest out-of-pocket costs when you see your doctors and hospital, gives you the flexibility to choose a doctor, and you would enroll in a prescription plan. This option is recommended for those folks who may see doctors in different states, have a house in different places, also don't want to be bothered with out-of-pocket cost. The supplement plan is going to be very easy to add and have with controlling costs of Medicare. The Medicare Advantage plan, on the other hand, will save you on the front end of your premium. Instead of your care being managed by Medicare, all the care goes to one of the Advantage plans that are being offered. And there are, and I didn't mention this before, we have somewhere between 30 and 70 Medicare Advantage plans offered in each market. Companies that offer Advantage also offer supplements. So when you refer to an insurance company by name, they can offer both options. Okay, so the Medicare Advantage plan, you may have a 0 monthly cost, but you're still paying the $202.90 for your plan. These plans have networks of specific doctors that are contracted with the plan. So you're going to want to use the doctors in network. The plan will typically include your hospital, medical, and prescriptions, and some extra benefits like dental, vision, gym, and over-the-counter benefits. So filling in the gaps. Medicare all by itself, option 1 and 2, may not be enough. According to Consumer Financial Protection Bureau, approximately 66.5% of bankruptcies in the United States are caused by medical bills. This means that medical debt is the leading cause of bankruptcy in the United States. And we obviously, when you're in retirement, most of us are on fixed income. We want to avoid that by protecting you with one of our umbrellas. If we recommend long-term care, recovery care, if it's offered in your market, that's going to be a big ticket. Otherwise, you're going to spend down your money to be in a nursing facility or get custodial care. Cancer, heart, and stroke can help mitigate some of the out-of-pocket exposures with cancer. Hospital indemnity, for sure, if you have a Medicare Advantage plan, you'll likely want to have a hospital indemnity plan. And dental, vision, hearing, those are things that we can assist with filling in the gaps for you. Here are umbrellas, protecting your exposures. Minimally, we're doing umbrella 1, getting you your Medicare plan with your drug plan. We may recommend the cancer, heart, and stroke. We may recommend the dental. We may flip some of the policies between the umbrellas, but it really depends on you. So let's talk a little bit more about these umbrella policies. This is one of our clients, awesome guy. Unfortunately, he did pass away due to cancer. He did have a Medicare supplement plan, lived in the state of New Jersey, was being treated out of Boston, which is where his son was. He wanted to be by family during the treatment. And because he had a supplement plan, he was able to do that. But there are expenses when you have something like cancer, for instance, that Medicare or your Medicare plan is not paying. Things like transportation or family staying at a hotel while you're being treated, non-traditional treatment. There are treatments out there that people may want to try as opposed to regular medical treatments that a cancer policy can help you with. Custodial care, if you had a stroke, Medicare is not paying for the custodial care. You're in that nursing facility, you come home, you may need some extra help because you can't do everything. These types of plans pay a lump sum benefit for you when you're diagnosed with cancer and can help offset some of the costs associated with just recovering from the cancer, heart, or stroke. Okay. And they're great policies, although they're not offered in every state. So it really depends on where you live and your situation, whether or not we recommend it. But we have this for a bunch of clients and it's worked great for them. Skilled nursing, really big concern for people. These are amazing clients, and I say the word amazing because my client there, you see her, she always uses the word amazing. We are at Liberty State Park. These folks right here, you see them, they're like family to us. And unfortunately, she was diagnosed with dementia, and her husband, he was charged with taking care of her because Medicare is not giving her enough coverage. Now, she has a Medicare supplement plan, does cover short-term skilled nursing, 100 days in the skilled nursing facility, but it's not covering feeding. It's not covering making sure she's safe in her environment. There's a lot going on when somebody gets Alzheimer's or dementia or is not able to care for themselves. So these are things that Medicare is not covering, and we want to make sure people know it's important to look into these things before you're diagnosed because we can't really help you after. Here's the Medicare and Who book. It's a little bit small, but I will say that you'll see at the very top, it says skilled nursing facility care. Medicare covers short-term skilled nursing facility after 3-day minimum of being in a hospital. So you can't just simply go into a skilled nursing facility. Medicare will cover the first 20 days after you're discharged from being in the hospital. So let me give you an example of this. My father-in-law, he broke his foot, lived alone in his home, lived in a different state from us. We had to go get him to treat him. He developed an infection, needed to go into a hospital. It took about 3 weeks for him to recover or for them to get rid of the infection. And then he was finally able to get surgery on his foot. He was in a boot, couldn't walk. They moved him into a skilled nursing facility. He was there a little bit under 100 days. So you get 100 days with a Medicare supplement plan. We had him in that because he was under 65, disabled, with a lot of medical issues. So we knew the supplement plan was the right plan for him. But while he was in that facility, we didn't really have to worry about the expenses, but they wanted to keep him in there longer. And we're like, no, he's coming home. When he came home, he got the rehab he needed to go back to his house. But it took a while to get him there. And traditional Medicare and even the supplement or Advantage plan is only going to go so far. So this is just another chart. Note that what Medicare calls skilled nursing, again, the first 20 days under either the Medicare Advantage or the supplement is going to be paid the first 20. If you're in 21 through 100, the supplement plan is going to pick up the 100 up to the 100 days. If you have an Advantage plan, you're paying typically about $220 a day. Past 100 consecutive days, you're paying it all. Now, we have options that are really affordable. They're affordable to you. We have a free report that we put out, getltcreport.com. We have a book on long-term care options. If you'd like to schedule something, you can do that with Scott. My husband, Scott, does a great job in helping people manage that, especially because it was something close to him when his father broke his foot. We know how expensive something like this can cost. So you can schedule an appointment by giving us a call or go to chatwithscott.com to schedule an appointment and get your free report. The free report is getltcreport.com. It's going to answer some of these questions like what's a reverse mortgage, asset-based long-term care solutions, when to use Medicaid to pay for long-term care. So there are some strategies in the report that could be very useful. And again, it's free, so we encourage you to download it. So you want to make sure that you understand Medicare is not giving you everything you need, and we do have some of the options that can assist you through the process. Myths about Medicare. There are some major myths about Medicare, true and falses, that we'd like to just make sure people understand. A lot of misconceptions. One is that you must have to pay a fee to use a broker and get their help, like people like us. That is not true. The truth is we don't charge you a service of any kind ever for a service. Our service is free, whether we enroll you in a plan or not. We do not charge you a fee. Myth number 2 is nobody works for free. So the insurance company, they do pay us if we enroll you in a plan, but they must charge you a higher price. Well, that is not true. The insurance company doesn't charge you more if you work through a broker. You pay exactly the same whether you use our help or do it alone. And so working with a broker really just gives you a heads up because we have a lot of access to different plans and we can help you navigate through them all. Myth number 3, if you get paid by the insurance company, you must have a bias towards one company or the next. Now, that's not true, specifically with the Medicare Advantage plans. Medicare structures that somewhat for us. But we have access to over 25 different companies and we get paid by whichever one you choose. So we aren't biased. We really want to help you find what's right for you. We don't focus on, our income. We focus on finding you the right plan. So the 3 truths of using a broker. Truth number 1, no fee charge. Truth number 2, the price you pay to the insurance company is the same with or without our help. Truth number 3, with over 25 companies to choose from, we aren't biased. So retirement planning, Social Security questions, we get those a lot. Again, these are some of our clients who came to us and said, we want to make sure we're not running out of money in retirement. This is them with their grandchildren, and they wanted a rock solid plan. They wanted to know that they weren't going to have to struggle with traveling. They love to camp, they love to travel, and those are things that were on their list in retirement. They wanted to be able to help with their grandchildren's education, leave a legacy. A lot of folks want to pay less taxes, and they want to have the financial freedom to have enough money throughout the entire life. And those are some of the things that we can assist you with. Those are some of the things that Scott, if you make an appointment with him, he just does like a brief 15-minute consult with him that can help you figure out some of the things that may be necessary. We firmly believe that you deserve to have safe money in retirement. You work your whole life to save, and you may have money in different places. We want to make sure that we assist you if you choose to let us work with you, that your principal is 100% protected from market loss or risk, right? Because the market is volatile. We also want to make sure you're getting enough growth. We're not looking at something that isn't going to grow with you so that you have enough money to get you to the end. And we have a lot of different ways that you can withdraw money and options available. All right, so putting it all together. We have a 3-phase process with Medicare. The first is getting yourself educated. That's what we're doing today. We went through the seminar. You're going to get a folder if you haven't gotten it in a nice red envelope, a folder with information about the cost of Medicare, a book on Medicare, a roadmap of Medicare that just really educates you in the process. You can also go to Medicare.gov to get additional information, or the Social Security site. That's giving you information right from the horse's mouth. But working with us, we're going to educate you in more concise manner. So we're structuring that education to you personally. The next thing we're going to do, we call it phase 2, is the consult. During the consult, I'm going to ask you a bunch of questions. You're going to ask me questions. And we're going to give you a personalized summary recommendation on what is going to be right for you. This doesn't cost anything. We want to make sure that you are going through the process. We're going to give you that enrollment by advice. And then the final phase is what we call lifetime support. Now, we don't just hit and run and roll you in a plan and you never see us. You have, as long as you work with us, you'll have lifetime support. We want to make sure you got your ID cards. We want to make sure that you're alerted to rate changes. We'll send out text, emails, mail letters to you. Our agents may call you just to alert you of things happening, especially during the annual enrollment period. We want to make sure you have that support you need in getting the help you need with Medicare. So I look forward to working with you, answering your questions. Appreciate you sticking through the end. Thanks a lot.